I'm Rick LeMoine. I'm the Chief Medical Information Officer at Sharp HeathCare in San Diego. IT is a very important part of what happens at Sharp, and we've been involved in electronic systems for a long time. Currently, Cerner is our solution on the inpatient side, and for the majority of our ambulatory practices, they're on some version of Allscripts. We recognized a problem that we had several years ago with a disconnect between endoscopy procedures, endoscopy reports, and endoscopy images, and started to look at some of our similar organizations across the country and learned about a company called Apollo, who seemed to have an answer for at least some of this. And the more we investigated, the happier we became in that this really seemed to be a strength of Apollo's inventory. And so that was the first time that we got introduced to the company, and it really has been I think a successful relationship for both Sharp and Apollo ever since that time. I think the big piece here is you have to have a strategy. Worry about who you're gonna deal with, and maybe the technologies that you're gonna use. Save that until you get your vision. And then the biggest thing you can do, in my opinion, is talk to somebody who's a little farther down the road. So we have a certain strategy that we have on the inpatient side for our DICOM images, but on the ambulatory side in particular, certainly for all of our non-DICOM work that we do, that's Apollo. And it's as diverse as endoscopy, the other oscopies that are out there. Dermatology's a biggie. If we have the need to capture some images at one of our urgent cares, that's a go-to Apollo solution there as well. So our strategy at the current time is, if this is a non-DICOM image of any kind, if it's video, if it's still, if it's from an endoscope, a bronchoscope, or whatever scope, that's Apollo. And the organization kind of has to live with that. But then we have to be able to fit the Apollo workflow into the workflow of the team that needs an answer. So for derm, for instance, and derm is actually relatively easy in that a lot of the images are the same, and they're captured relatively simply. But when you get into the endoscopy stuff, for instance, the doc has got to know that when you hit the button on the endoscope, whether he's doing a video or whether the video is just going to be film or audio as well, or whether or not you're going to have stills out of it, that's all he has to do is hit the button, and it's going to be in the record. So that's kind of the approach that we need. It all starts with having a plan, having the organization buy off on the plan, and then make sure that you can fit the plan into the workflow of the different departments. The piece with patient care is just bringing it all together. I mean, there is nothing in this day and age as frustrating for the caregivers, for the providers, docs and nurses and other people at the clinic, for instance, to have something missing from the chart. So someone is coming in for a follow-up appointment because of bad GERD, for instance, where they may have be relying on some images of the lower end of the esophagus. The last thing you want is for those images to be lost or not available at time of the second visit for follow-up. So this just changes everything for us. It's just a great way to ensure the continuity of care, and that all of the pieces that you need are available in one spot. Certainly our Sharp community benefits. You can come to say an SRS urgent care center, and any images, like your derm images, endoscopy images, any other images that were recorded are available. Or you come to the urgent care with something new, we can record images there in the urgent care, and then when you see your PCP back for a follow-up visit related to that visit, those images are just part of the record when you see your PCP. So it really is, across the whole Sharp community. And for us, people talk about that. And they talk about, hey, I had these, I had X, I fell down, I cut it, or I didn't know what it was. I thought it was a bite, maybe it was Lyme disease. They took some pictures. I went back, I saw a specialist, and they were able to see the pictures at the same time. It's great for us. The workflow piece, that's where it really takes planning in setting up procedures like this. Because the last thing you want is get ready to do the endoscopy and it's, wait, stop, we have to get the camera ready, we have to get this ready, we're not ready with that. So when we make a decision to put this kind of capture technology, say, into an endoscopy workflow, it's going to the endoscopy nurse and the endoscopist, seeing exactly what it is they do and how we can fit into that in a non-obtrusive way. That's the whole secret for it. And then when you do that, their workflow gets even more streamlined than it was before. We're big into Lean Six Sigma, all that kind of stuff about getting rid of waste and inefficiency. And this is something that's really helped us in that regard. Departments are different. Don't think that you can use the same detailed approach for, say, endoscopy as you could for derm, because it's going to be different. As I mentioned earlier, you have to fit the workflow into the workflow of the dermatologist, the endoscopist, the endoscopy nurse, the nurse in the urgent care, for instance. You don't want to have them have to do something different or something they're not used to. Just fit it into the workflow. And from day one of the great things that we learned about Apollo is you guys can plug into almost anything. I remember when we started endoscopy, there were, we had multiple devices, and it was just a non-issue. So it was one of the things that made me very comfortable that we made the right decision. But with different departments, you need a different approach. Take your time. Make sure you get people from the pointed end of the spear, so to speak, involved in the very beginning, and you'll make the process much smoother. Absolutely. And one of the ways I would measure that as a success is we've been doing this, now, almost 6 years, and we still like dealing with you. I think the biggest benefit is the integration of imaging into the medical record. It's no longer stored in a file desk that might be down the hall around the corner on a lower floor. It's just part of the record. And that benefits patients, benefits doctors. Anything that benefits our doctors and our patients and our nurses benefits the organization overall. It's interesting how the dermatology folks have been able to utilize this during telemedicine visits. It doesn't need a special setup. I mean, it just, they call the image up on their desktop, and the patient at home can see it as well. So there are all kinds of ways that it just makes this relationship between the provider and the patient closer and tighter. It's been phenomenal in that regard. Well, certainly working with a company that doesn't say no and has a kind of can-do approach has been a big one. It's affordable, which is a big thing for us. We practice in Southern California, tight market down here. It's competitive, so affordability is a big piece. And we've been able to, kind of upgrade and move along without a whole lot of hiccups and bumps. So I think that's really part of our success story. EMR optimization would probably be near the top of the list, and doing things to relieve frustration for providers, nurses and physicians in particular, with the EMR. Getting rid of clicks, getting rid of alerts and pop-ups that are really just kind of speed bumps for no good reason. Decreasing the amount of travel time, and by travel time I mean mouse time, that people have to do to get their data. That's kind of number one on the list, and Close behind it is developing solid clinical decision support so that you can be, your system can be a great aid to memoir, can stop you if you're doing something wrong, can point you in the direction of doing something right. I'm an intensivist, 71 years old today, I still practice. I know that when I admit someone to the ICU with sepsis, I can call up a sepsis power plan, and I'm not going to forget to do the DVD prophylaxis. I'm not going to get my solutions mixed up because it's all in plans that we have built in that. It's great.